Instructions for using the new Dana Inset II infusion set. Before inserting, wash hands and sanitize, prior to preparing the Dana Inset II infusion set. Insert the infusion set into the recommended areas. Consult with a healthcare professional for further advice, and avoid areas near and around previous insertion sites. Disinfect the insertion area with an alcohol swab, as instructed by a healthcare professional. After the disinfected area is dry, insert the Dana Inset II infusion set. Remove the protective film by pulling the red tape. At the bottom, remove the sterile paper. Press the 3 protrusions on each side of the cap, simultaneously with one hand, and open the cap with the other hand. Caution: when opening the lid of the Dana Inset II infusion set, be careful not to bend, touch, or damage the cannula.
If the Dana Inset II infusion set is not securely seated within the insertion device with the cannula facing forward, pain or minor injury may occur. To prevent this, the following procedure must be followed to prevent damage or dislodging of the Dana Inset II infusion set.
Slightly turn the front part of the tube out of the slot and pull out. Carefully pull up the tube from the insertion device to unwind the coiled tube.
Caution: be careful not to touch the Dana Inset II cannula.
When unwinding the tube, don't use too much force. The needle and soft cannula of the Dana Inset II infusion set could become separated. Now, connect the Dana Inset II infusion set to the Dana Insulin Pump. Make sure to prime properly, removing all air, and ensure there are no bubbles. Caution: whilst priming, the cannula should be held facing downwards, to prevent the insulin from wetting the adhesive tape. Carefully pull the adhesive tape upwards, taking it off in a circular motion. With the bottom side facing up, hold the wrinkles on each side of the insertion device with the thumb and index finger. Hold the white handle in the middle, with the thumb and index finger of the other hand, and pull it up until it's locked, with a click sound. Remove the light blue needle protector by carefully twisting it. Make sure that the transparent soft cannula is safe and securely attached with the introducer needle. Caution: prior to placing the insertion device onto the disinfected skin, the tube should be placed into the small groove. This prevents the tube getting under the adhesive tape. After placing the insertion device onto the injection area, insert the Dana Inset II cannula by simultaneously pressing the circular dented area on each side. After the deployment, gently push the center of the insertion device to ensure good adhesion with skin. Remove the insertion device, including the introducer needle, by holding the middle white handle and gently pulling away from the body. Gently rub the adhesive tape to ensure good adhesion to the skin. Remember to fill the empty space of the soft cannula with the correct fill volume. The Dana Inset II allows for convenient disconnection, useful for showering or swimming. Place one finger directly in front of the cannula housing. Hold the adhesive tape and gently press on each side of the connector tab. Pull the connecting tube straight, perpendicular to the cannula housing, in the same direction of the tubing. Place the protective cover into the cannula housing until secured with a click sound. If necessary, prime the infusion tubing until insulin drips from the needle. Caution: always prime with the needle facing downwards. Gently depress the ridged grip to remove the protective cover. Place one finger on the adhesive tape, directly in front of the cannular housing. This is the same method as removing the tube earlier. Push the tubing connector inwards, until a click sound. This confirms that the connection is secure.